In recent years, the Canadian Dental Association formed a task force for the future of dentistry, bringing together representatives from across the country. One of its key recommendations was that the profession must do more to oversee dental seminar content, ensuring it is free of bias and scientifically verified. But in practice, very little has been done, especially at the provincial level. And if Alberta is any example, the problem isn't being fixed, it's being hidden. Alberta's own representative on that CDA task force sat on a committee that severely sanctioned a dentist who had spoken out about harmful overdrilling inspired by a US seminar program. That dentist, a whistleblower, had written a 2010 book exposing the dangers of these aggressive, unscientific cosmetic procedures. The irony. The same Alberta Dental College had already issued an internal warning in 2007 about over-treatment of unsuspecting patients, explicitly referencing corruption in dental seminars. Yet the dentist who echoed those very concerns publicly was punished with a prolonged suspension recommended and a $200,000 fine. Across Canada, dental boards or colleges require dentists to complete a certain number of continuing education seminar hours to stay licensed, but the weak spot is what counts as education. Many seminars have never been properly reviewed, and some have promoted risky pseudoscientific procedures that led to real patient harm. You'd think that kind of negligence couldn't go on for decades, but shockingly it has. When the Alberta whistleblower dentist was later elected to the dental board and tried to reform the system, he was told by the board president that blocking a course could lead to a lawsuit from the seminar company. Within months, he was pushed off the board, after submitting a list of reform proposals for the next meeting. Meanwhile, complaints kept coming in, from patients treated by dentists trained in one of these same US seminar programs. A few legal experts even noticed the trend, but none spoke out publicly. Canada has failed to take broad action against seminar-driven overtreatment in cosmetic dentistry, questionable TMJ and headache cures, risky devices like the agar, and even faulty materials like the Resolon root canal filler. Tens of thousands of Canadians are now living with complications, many completely unaware that their dentist's harmful treatment was inspired by unregulated seminars from the United States. In one Alberta case, the dental college even reportedly employed a Las Vegas seminar attendee as an expert witness, to judge an Edmonton dentist trained at the same seminar. That expert claimed the dentist's use of the Agi-Gay device met the standard of care simply because it followed the seminar's protocol. This twisted logic allowed the dentist to escape discipline and the patient to lose their refund. To be clear, not all regulators have ignored the problem. In Ontario, the Dental Board has stated it would no longer accept credits from a Nevada seminar series once it lost its recognition from the American Dental Association. That's progress, but it's isolated. Across the rest of Canada, fringe dental fads continue to slip under the radar, often under the banner of innovation or holistic care. Many of these ideas, from biologic dentistry and tongue cutting for better breathing to neuromuscular bite treatments and so-called cavitations, are pseudoscientific fads imported from the US and promoted through private seminars, not universities. Until the profession takes real steps to inform the public, the safest advice may be this. Before agreeing to any unusual dental procedure, use artificial intelligence or a trusted scientific source to check whether that approach has been verified in peer-reviewed research. Because the truth is, Canadian dentistry has allowed corrupt US seminar culture to shape what happens in the chair, and patients have paid the price.